Dear audience, dear chair, my PhD thesis is about developmental defects of enamel, etiological aspects, and clinical management. My name is Mlinkó, working at the Department of Pediatric Dentistry and Orthodontics, and my supervisors are Noémi Rózsa and Gábor Varga. My SMS is Bianca Goldzio. And my vision is to improve the life quality of children with developmental defects of enamel, with better clinical assessment. And my mission is to discover causes of these defects and finding new intervention protocols that are improving pediatric dentistry. To achieve this mission, these two projects about the different enamel defects through certain risk factors and metabolic processes are my specific goals, and I will explain them ahead. My first project is about investigating different types of antibiotics at early childhood as risk factors in molar incisor hypomineralization. I will use the MIH abbreviation from now. This is a systematic review and meta-analysis. The background is that this MIH is affecting the first permanent molars and the incisors, and this is the most frequent enamel disturbance with the global prevalence of 13.5%. The etiology is still unclear. What we know is that the amelogenesis of the affected teeth are at the same chronological time. Many putative factors are listed in the literature, and also the harmful effect of tetracycline in the odontogenesis is known, but we have less knowledge of the effect regarding to the other types of this therapeutic class. So our aim is to evaluate the strengths between early childhood antibiotic intake and MIH. For this, our clinical question is that do early childhood antibiotic intake increase the risk of MIH? Our question framework is a PO, where population are children within the age of 6 to 14, which is the most appropriate time for the diagnosis. The exposure is the different type of antibiotics, and the outcome is MIH. Our hypothesis is that early childhood antibiotics increase the risk of MIH, and our clinical implication is to recognize opportunities for prevention. In our systematic search, we conducted 3 databases and 2 different domains. Here is our flowchart of selection, where we ended with 36 articles, from which 29 could we include in the meta-analysis. Our outcome measurement is the MIH, which causes severe hypersensitivity, post-eruptive enamel breakdown, and it can even lead to tooth loss for the children. All of our finished analyses are about the risk assessment of different antibiotic intake in the MIH development. For the outcome measurement, we used odds ratios with 95% confidence interval. The first figure is about general antibiotic intake, where our population are children who have taken antibiotics in the first 4 years of life. This is the time when these affected teeth are under development, and the risk factor can influence negatively the dental enamel development. The diagnosis can be done later at the age of around 8, so that's why all of our studies are retrospective, which we used in our subgroup analysis. We had case control and cross-sectional studies. In our population, we ended with 20,000 patients, where in the event column you can see the MIH affected patients, and we had also control patients, and in the figure on the right side you can see when MIH was more common with early childhood antibiotic intake. The heterogeneity level was 50%, which can be due to the fact that we had no data about the dose and the exposure time of the antibiotics, and also no data for which disease what was used for. Our final result is 1.56 odds ratio, which means that 56% higher is the odds to have MIH with early childhood antibiotic intake. This result is mathematically significant, so our conclusion is that MIH has a clear association with antibiotic intake, and our clinical implication is to suggest to avoid inappropriate use of antibiotics, although the retrospective study design cannot make a strict cause-effect relationship in the etiological factors, so our research implication is that we need more preclinical studies which could make the evidence stronger. Here are the other analysis with the different type of antibiotics, and we had also see the prenatally taken antibiotics. All of them have the same tendency as the general antibiotic intake, though none of them reach the mathematical significance level due to the low number of the studies. The strengths of our study is the mathematical significant association between antibiotic use and MIH, the high population number, and it shows us a clear importance for a research implication in preclinical studies. The limitations are the retrospective study design, which cannot make a strong cause-effect relationship in the etiological factors, the low number of studies regarding to the type of antibiotics, and the prognostic factor measurement, because we do not know the exposure time, the dose, or the disease effect. And the last is the methods. Just a few studies used medical records. Mainly the data was based on questionnaires. So our conclusion is that early childhood antibiotic intake is associated with MIH. The implication for practice is to avoid inappropriate antibiotic use, and the accurate medical documentation would needed. The research implication is that now the preclinical studies suggesting the harmful effect of antibiotics in the enamel of the teeth, but the current data did not reveal a clear evidence between antibiotic use and MIH. So the preclinical studies should aim and understand the causative mechanism of action in the development of MIH. Here is our first project progress, where it's in the manuscript writing status, and we are planned to finish it in June and submit in July. Let me introduce the second project, which is investigating the association between phosphocalcic metabolism disorders and developmental defects of enamel. The method is the same, it's a systematic review and meta-analysis. And the background is these defects can be qualitative or quantitative disturbances, which can range from light disturbances till even the total absence of the enamel. The prevalence is 30%, even the primary and permanent dentition. The etiology is multifactorial, and in the amelogenesis what we know is that at the mineralization phase, calcium and phosphate are needed, and if there is any change in the systemic calcium level, it can directly impact the formation of the enamel. The systemic calcium level can change due to the pathology of organs which are responsible for calcium storage, or certain chronic diseases which can reduce the calcium level. This leads us to the aim that the impact of phosphocalcic metabolism disorders and the appearance of developmental defects of enamel. Our clinical question is that are these phosphocalcic metabolism disorders increasing the odds of the different developmental defects in the enamel? Our question framework is a PO, where the population would be children. The exposure is the disorders which affecting the phosphocalcic metabolism, and the outcome is the different developmental defects of enamel. Our hypothesis is that these type of diseases increase the risk of enamel defects. And the clinical implication is that the developmental defects can be a warning sign of general pathologies, and modifying some behaviors could limit these enamel defects. We made a preliminary search with 3 different databases and 3 different domains, and we are at the beginning of this project, so soon we will start the selection. So let's sum my projects. Both of them are systematic reviews and meta-analysis. The first we would like to finish in July, and the second we are planning to finish in October. I would like to finish my presentation with this quote: "The aim of science is not to open the door to infinite wisdom, but to set some limit on infinite error." Thank you so much.
As a clinician, it not only epidemiology is important. I would like to ask, what are the guidelines for the treatment of this disease?
For MIH, we have not. There is not a gold standard. Unfortunately, the clinical management is really difficult because they are small children with high hypersensitivity, and the teeth are really the quality of the enamel is poor, and that's why and the adhesive techniques are sometimes unsuccessful. So the problem in this disease is that there is no gold standard and no guideline yet. Only we have in the literature suggestions, and there is already an index which can guide us a bit how to treat this, which is the MIH treatment need index, which can help, but still because of the poor quality of the enamel, many time the treatment is unsuccessful.
If there are no more questions, thank you for your lecture.
Thank you.
Congratulations.